Hello everyone. How many of you would be interested to know the 5 years follow-up of an extremely complex case of a full mouth implant reconstructions? Yes, my friend, myself Dr. Mayur Khernar, I am on a mission to give all the patients who have lost all their teeth full mouth implant reconstruction in the least possible time. You can subscribe our channel on YouTube and see variable cases of full mouth implant reconstructions as well as some case studies and lot of testimonials of the patients who are very happy living their life right now. So let me come to the case. This is the case of a skeletal class 3 relationship where we have given the patient fixed teeth with the help of full mouth dental implants by the technique of all on basal cortical. Now let me tell you what is skeletal class 3. So in order to know the skeletal class 3, we should know what is skeletal class 1, class 2 and class 3. So my next slide, this shows you first side. On the left hand side up, you can see it is the ideal skeletal class 1. That is the ideal way every individual is. So in which upper jaw is slightly ahead of the lower jaw, but it is not too much ahead, not too much behind also, even the lower jaw. So that is the skeletal class 1. What happens in a skeletal class 2? In a skeletal class 2, your upper jaw is quite ahead or sometimes your lower jaw is quite behind. So that happens in a skeletal class 2. What happens in skeletal class 3 is your lower jaw becomes quite ahead compared to that of the upper jaw, or your upper jaw becomes quite behind. So today's case is going to be about a skeletal class 3 relationship. So in 2015, Mr. Naik presented to us in clinic and then we restored his teeth in 2015 with the help of ABC technique in 3 days, and in 2020 he came to us to restore his temporary teeth to the permanent. So temporary in the terms of a long term, hybrid temporary. So that is the before of the patient. In 2015 when he came, it was a typical skeletal class 3 with 13 millimeter of overjet. That means the lower jaw was 13, that is 1 centimeter ahead of the upper jaw, and it was very difficult. Though all the teeth were loose and mobile, so we decided to remove all the teeth and we decided to give him an implant supported full mouth reconstructions without doing any orthognathic surgery. Now orthognathic surgery is something which is required when your all teeth are healthy, where you can just take your lower jaw behind without removing any teeth. So that is the situation, kind of a cosmetic surgery. But here this patient is elder, there is no need to take the whole bone in behind. We can do with some kind of prosthetic manipulation, we can achieve this kind of result, which is very difficult, but it requires a skill for that. Now this is a X-ray of the patient. You can appreciate on the left hand side and on the right hand side what is the change, how the lower teeth were front before and now how the teeth has been taken back. That's how the difference has been created. This is the X-ray of the patients in 2015 when we gave him a teeth in 3 days. That is the profile of the patients in 2015. This is the intraoral picture 5 years back. That's the intraoral images. This is a temporary hybrid prosthesis given to the patient for a certain period of time, around 2 years. But patient maintained it very well for 5 years, and then patient came to us in February 2020 where teeth were all treated, all were flat. So we decided to remove the teeth and give him a definitive prosthesis that is called as porcelain prosthesis, that was designed and framed and then it was given to the patient, and that's how patient received the teeth in the upper and lower jaw. That's a new definitive prosthesis. That is a new final prosthesis of the teeth which he got. That's the profile of the patient before in 2015, then after in 2015 in 3 days with the temporary teeth, and 2019 with the definitive permanent teeth. This is the X-ray of the patients before, and this is in 2020. Recently the bone level is still the same. It is in fact very good and very well maintaining. That's the profile of the patients 2015 and 2020. This is a testimonial of the
clinic, yeah, and we'll see you again in 3 years.
Thank you so much, sir. Thank you so much.
We are happy. Now I'm really happy.
Thank you so much. Thank you so much.
And I'm really happy about your clinic.
Thank you so much, sir.
So you can see how the patient is happy about the treatment after the 5 years of his results, and that's how any individual can get this. If it is a very complex case, then still the patient can stay happy. Then why not you, even if you have a regular jawbone condition? Definitely you can. So if you like this video, if you find this video valuable, please do share with the persons who really need this, and please do not forget to subscribe it so that you can stay connected with us for our further next videos. So see you soon in our next videos. Thank you. I sign off. Dr. Mayur Khernar. Jai Hind, Jai Bharat.